Hi everyone, my name is Katie and I am a midwife on the antenatal ward. I have worked at Poole Hospital for almost 3 years now, and today I'm going to be talking to you about induction of labour. So I'm just going to load some slides to share with you. Okay, so today we're going to cover what is an induction of labour, why it might be recommended, what's involved with an induction, how long the induction could take, what you can do to prepare at home, and things that you can do whilst you're in hospital too. So what is an induction? An induction is a way of artificially starting labour using a range of methods, more of which we will talk about a bit later on. So 1 in 5 pregnant women in the UK will be offered an induction, so it is fairly common. And at Poole, we do anything from 0 to 6 a day and sometimes even more. So there are many reasons why your midwife or your doctor may recommend an induction, and below are the ones that I can think of, or those that we see more often. So we'll talk through some of them. But if your midwife or doctor recommends an induction for reasons that aren't on the list, then they will obviously talk through the reasons why, and the recommendations and the risks and the benefits as well. So probably the most common one on this list is prolonged pregnancy or post-dates. Now what this means is that if labour does not start laterally by the time that you're 12 days overdue, then you will be offered an induction of labour. And the reason for this is that there is some evidence to show that from 42 weeks, the placenta isn't working as effectively as it could be, and obviously that carries risks to baby. The next on the list are broken waters or ruptured membranes over 24 hours. So if you're over 37 weeks and your waters break, most women will go into labour within 24 hours, or will be in established labour at 24 hours post their waters breaking. So obviously established labour means having 4 contractions in 10 minutes every 10 minutes, and being about 4 centimetres dilated. So if after your waters break, if after 24 hours that hasn't happened, there is an increased risk to both you and baby of infection. And for those reasons, you will be offered an induction. And then the next on the list is reduced fetal movement. So during your pregnancy, it's really important that you keep a close eye on your baby's movements. And if they become reduced or the pattern of movements changes during pregnancy, it's important that you give us a call and then you come in for assessment. If there's unexplained reasons as to why your baby isn't moving and this continues during pregnancy, then you will be referred to a doctor who may recommend an induction of labour for that reason. And then pregnancy-related conditions. So on that list, it's obstetric cholestasis, preeclampsia and gestational diabetes. So these conditions carry risks to both you and your baby. And so for that reason, your midwife or consultant may recommend an induction. Now, similarly for pre-existing medical conditions as well, if you do have a pre-existing medical condition, it is possible that you are seeing a doctor for that reason, and it could be that your doctor and our doctors at the maternity unit liaise with each other, and it may be that your medical condition is exacerbated by pregnancy for many reasons, that they may offer induction of labour for those reasons too. And then moving on, so how is labour induced and how long will it take? So I always say to ladies, prepare to be in hospital for a couple of days. It's really difficult to predict how long the induction process is going to take. It could be that you're with us on the ward for a few hours, or it could be that you're with us for a few days. So it's always better to both prepare physically, emotionally and mentally to be in hospital for a few days. And it solely depends on a lot of factors. The reason you're being induced, if it's your first baby, your 8th baby, and the way that we're inducing you, where you are in your pregnancy. So lots of different factors contribute to how long it can take. So it's, like I said, it's very difficult for us to kind of say how long it is going to take. And then the methods of induction. So a membrane sweep or a stretch and sweep. Now, a lot of people realise that actually having a stretch and sweep is part of is an induction process. Unfortunately, at the moment, due to coronavirus, we are unable to offer routine stretch and sweeps, but that doesn't mean that we can't talk about them. So a membrane sweep is a vaginal examination, and it is aimed to separate the membranes or the sac of fluid around baby from the top of the cervix. And what that does when they're using a sweeping method is it releases hormones that will hopefully pop you into labour within 24 hours, and it's about 50% effective. So then moving on to the Prostin gel pessary. Now, this is used for our first-time mums or those that are being induced because their waters have broken and they haven't gone into labour within 24 hours. Unfortunately, I don't have any of the Prostin gel to show you because it is a medication, so it is kept at the hospital, and obviously I'm at home today. So we'll just talk about it. So Prostin is a synthetic hormone and it's designed to soften your cervix. It's like a gel-filled syringe, and the gel is inserted behind the cervix, so it involves an examination. And sometimes the pessary alone is enough to pop you into labour. And then what will happen is 6 hours after the first pessary is inserted, we'll offer you another examination, and if needed, if the cervix is not quite soft enough, then we can give you a second gel. Now, you can have a maximum of 2 gels in 24 hours, but you can actually have 4 gels overall in the induction process. So that goes back to not being able to predict how long you're going to be in hospital, because that could take a couple of days. If you are being induced using the gel method, then we would advise that you stay in hospital because we would like to monitor you and your baby a bit more closely. So your baby will be monitored every 6 hours or sooner if you or your midwife is concerned. And then the balloon catheter or cervical ripening balloon. So this is used if you've had a baby before, and I do have one of those. So just going to make sure that you can see this correctly. I'm going to bring the screen back to me. There we go. Yeah, there we go. So this is the balloon catheter. Okay, so I can show you how big it is. Lovely. So what happens with the balloon catheter is that using a vaginal examination, either digitally or with a speculum, the balloon is inserted through the cervix, and then what we do is we inflate it using these ports here with water. The water is inflated in the balloon, and then it creates about a 4 centimetre diameter. And then over a period of 24 hours, the inflated balloon sits at the top of the cervix, and hopefully with gravity, it will allow the cervix to dilate and the balloon to fall out. When the balloon falls out, that means you're ready to progress on to the next stage of the induction. Now, if the balloon hasn't fallen out within the 24-hour period, then we will do a further examination to remove the balloon and just see if hopefully it would have softened the cervix enough to break the waters, but just maybe not dilated it enough to be able to fall out. If you are being induced using the balloon method, and you're being induced for reasons such as a prolonged pregnancy or postdates, or that you've got a big baby on board, or for social reasons, then it could be that you could go home with the balloon in situ. And what would happen is that we would ask you to monitor your baby's movements at home and a few other things, and then invite you back into hospital 24 hours later to have the balloon removed if it hasn't already fallen out. If we are inducing you for reasons relating to your baby, so if you've got a small baby on board, if you're worried, or it's because we're worried about your baby's movements, for example, then you would be asked to stay in hospital where we'll be able to monitor you and your baby more closely. Now, moving on to the next stage, to the next part of the induction, so after the balloon or the crossed-in gel pessary, is the artificial rupture of membranes or having your waters broken. So the idea of the pessary and the idea of the balloon is that it softens your cervix and opens your cervix enough to have your waters broken. This happens mainly on our labour ward, where you have a room on your own and a one-to-one midwife. And the way it works is that we use a vaginal examination, and then we insert a small hook that we then pop a little hole in the sac of waters surrounding baby, and then that allows the fluid to flow freely through the vagina. And then we would hope over time that that will pop you into labour. And then the waters will continue to leak during the induction process, labour and delivery. There sometimes can be a delay with transferring you to labour ward to have your waters broken. This is because it is, like I said before, it is important that you've got a room on your own and a one-to-one midwife. And obviously it's very difficult to predict how long it's going to take. There can be emergencies that happen on the labour ward. It can be very busy. But be reassured that if there is a delay with you waiting, then the midwives will ensure that you and your baby are monitored during these delays. In some circumstances, it could be that you're able to return home during this wait time. If that's something that you feel like you would want to do, just discuss it with your midwife and they'll be able to advise if it is recommended or not. And then the final part of the induction process is the hormone drip. So this is after you've had your waters broken and maybe labour hasn't established. Then they will be looking at starting the hormone drip. Now again, this is done on labour ward, and it's a drip that goes through a small catheter in your hand or your wrist, and it is increased or decreased depending on the strength and frequency of your contractions. Whilst you are receiving the hormone drip, your baby's going to be continuously monitored using a CTG monitoring. Most of the monitors that we have on labour ward are wireless, allowing you kind of free movement and to be mobile during your labour. What can I do before an induction is offered? So natural methods of induction. Now you may hear your parents, grandparents, aunties talking about ways in which you can try to get labour started. Now unfortunately, none of these methods are medically proven. So we cannot recommend any of these, but what I would just say is if you are going to try some of these methods, then just make sure that it is definitely safe for both you and your baby beforehand. And preparing for your induction. So preparing for your induction, the biggest thing I can say is to be open-minded. There are going to be a lot of people that want to tell you their version of induction, but just remember that you're not them. This is your body and your journey. You can't predict how your journey is going to go, but just try and accept each version of events as they happen. And ask questions, ask lots of questions, ask your midwife before the induction, ask on the day of your induction, ask during the induction. We would rather answer your question, the same question 20 times, and you feel reassured that what you're feeling is normal, or be reassured of what's happening next with your induction process. So always ask questions. And then, as I said before, prepare for a long stay. We can't predict how long this is going to take. It could be that you're with us for a few days. So bring a book, a Netflix watch list, some colouring, some bubble bath, just anything that helps you relax. And most importantly, pack a bag. Pack a bag for you. If you can, pack a separate bag for baby, and leave baby's bag at home, and just bring kind of an overnight bag for you, just in case. And snacks. And the ward has endless amounts of tea, coffee, cereals and toast. But if you fancied a family-sized bag of Maltesers at 3 AM, you're going to really struggle to find that. So make sure you bring some snacks with you. And then during the induction process, so mobilise and rest, both of these are really important. You are going to be able to leave the ward, so take advantage of the nice weather, go for a nice walk, or even just sit on the bench outside, listen to a podcast, or inside the ward bouncing on a ball next to your bed. This can really help keep your baby's head fixed on that cervix, which will help the induction process and also help get your baby into an optimum position for labour too. So bouncing on balls is really important. But rest is equally important as well. So both for your physical and mental health. Rest when you feel tired, don't overdo it, have a nice bath, watch some TV. Eating and drinking. So you can eat and drink as normal during the induction process, and it's important to do so to keep your energy levels up. Stay hydrated with plenty of water, especially during the nice weather. And we do have lunch and supper menus available on the ward with vegetarian and gluten-free options. But as I said before, feel free to bring your own food with you. There is kind of a microwave and a fridge that you can use too. So monitoring of you and your baby during the induction process. So when you arrive on the ward, you have a set of observations taken either by a midwife, a care assistant or a student midwife. They will check your blood pressure, your temperature and your pulse, and then depending on the reason for induction, they will check that either 4-hourly or twice a day. Your baby is going to be monitored during the induction process using a CTG monitoring. Now, for those that aren't familiar with a CTG, what this is, it's a bigger version of what your midwife will use at home or at your clinic to listen into your baby. And it is strapped in place, and what it does is it prints your baby's heart trace out over a period of time, so we're able to analyse that. And depending on your reason for induction, that it could be that we are monitoring you every 6 hours, or it could be that we're monitoring you twice a day. But obviously, if you have concerns or your midwife has concerns, he or she may just pop you on monitor and monitor your baby sooner. And coping mechanisms. So this can be whatever helps you relax at home, down to music, relaxation, colouring, hypnobirthing techniques that you may have learnt in class. We do have aromatherapy that we can offer to help you relax during the induction. Please ask your midwife and they'll be happy to advise. It's really important though that you don't bring any aromatherapy oils from home, because there will be preterm women on the ward, and some aromatherapy oils can be very dangerous for them. So it's really important that you don't bring your own. But obviously, if aromatherapy is something that you would like to try during the induction, just ask your midwife, and we'll be more than happy to help. And then analgesia. So this could be down to breathing techniques, TENS machine, which I think if you don't, we don't have a TENS machine that we can offer you, but I think you can still hire those through the NCT or I think Boots. So check out websites and see if that's something you're interested in, see if you can hire a TENS machine prior to your induction or prior to labour, because they will help with both. Oral analgesia that we can offer you on the ward. We also have gas and air, pethidine, all of these things that you will probably all aware of anyway, because you would have had your birth talk with your midwife prior to induction. But obviously, if there's anything, if you're in pain and you need something, please just ask. And then birthing partners. Now, unfortunately, due to coronavirus, we are asking that you attend your induction alone. Your partner can drop you off at the hospital, that's absolutely fine, help you with your bags, but they won't be actually allowed onto the antenatal ward. What will happen is when you're ready to have your waters broken on labour ward, when you're ready to transfer because you're in established labour, at that point we'll just say, give your birthing partner a call and invite them in. So yeah, unfortunately, birthing partners are unable to attend during the induction process or be on the antenatal ward. But as soon as you're ready to go, they can come in. Kind of that is it for the presentation. Now, when we did the live version of this class, there were quite a few questions that were asked, so I thought it would be good to just pick kind of 3 of those and go over kind of the answers. So the one question that came up quite often was, can I decline the induction? Now, of course, everyone has choices. All women have choices, and if you want to decline the induction, then you can do so. What I would recommend is that please keep your induction date and your induction appointment and call on the day. You can discuss the reasons for declining with us on the day, and what we will likely do is invite you into hospital that day, either to us on the antenatal ward or to our day assessment unit, where we will be able to just do a monitoring of baby, an antenatal check on you, and then discuss with the doctor if needed when you feel an induction would be more appropriate for you, and the risks and benefits involved with waiting or delaying the induction. But yes, you absolutely can decline. And the next one was, how does induction of labour affect birthing experience? Is it more intense? This is quite a difficult question to answer, because everyone's kind of perceptions of pain is different. What I would say is that it is an intervention, so of course it's going to be different from natural labour. If you were to go into labour at home, it could be that your waters break and then you start having contractions, and it could be that you have one contraction, and then 20 minutes later have another contraction, an hour later another contraction, which is allowing your body to kind of cope with those contractions, if you would. Whereas when you come into labour, we are using synthetic hormones, we are using methods that will give you contractions. Now, that's not to say that we insert the gel pessary and 10 minutes later you're having 4 contractions every 10 minutes. These will still be gradual, but of course it's something that we're making happen rather than your body doing it. So that it is going to be different, not necessarily more intense, but definitely different to going into labour naturally. And then the final one was, can I still have a water birth? Again, very difficult to answer without knowing kind of the background and the reasons for induction. So there's many reasons why you can be induced and still have a water birth, but there are also sometimes when a water birth wouldn't be recommended. So, for example, if it's your first baby and you're being induced because your only reason for induction is because you are post-dates or your pregnancy is prolonged, and then you have the hormone pessary inserted, and within 6 hours labour starts, then yes, it could be that you go to the haven and you are able to use the water during labour and delivery. If at any point in the induction process you need to have the hormone drip, so the oxytocin through the cannula into your hand or wrist, then it would be advised that you don't use the pool. So again, very difficult to answer, but a pool birth is not out of the question just because you're being induced. Okay. And that's all we have to talk about today. Thank you for watching, and it may be that I see some of you on the antenatal ward soon. Bye.